Okay, so I'm going to start my assessment by checking my chart. I will be checking her birthing history and her pregnancy history for anything concerning, which I see that there isn't. And I will also be checking her current vitals, which they all look good. So now I will start. Knock, knock. Hello, my name is Allie. I'm going to be your nurse today. I'm then going to provide privacy and wash my hands. I'm going to do a quick postpartum assessment. Is that okay? All right, and I'm going to start by looking at your breast. Are you planning on breastfeeding or bottle feeding?
Breastfeeding.
Okay, and since she's breastfeeding, I will be able to touch her breast. So I'm going to start by palpating her breasts for engorgement. Is that okay if I feel? Okay, I'm feeling them and they feel fine. I'm now going to be assessing her nipples for any trauma. I don't see any cracks, bleeding, or ulcers, so they look good. I'm now going to move to her uterus. I'm first going to be assessing for any bleeding, which there is none. And also at this time, I'm going to assess her lochia. There are 3 types: rubra, serosa, and alba. She appears to be having rubra, and I will assess her amount by looking at her pad. Now I will be assessing her fundus, so I will be putting my hand lower on her abdomen and then above the umbilicus, a couple inches above, and I'll be pushing down until I feel the fundus. I'll be feeling if it is firm or in midline, which I feel that it is midline and firm. If it was boggy, I would massage it until it is firm. So next I'm going to move to her bladder. Have you voided recently? Okay, and was it your normal amount?
Yeah.
And your normal rate? And did you experience any pain?
No.
Okay, so all of those were good. I will now be moving to her bowels. Have you had a bowel movement recently? Okay. I'm now going to be moving to her episiotomy, where I'm looking for any lacerations. She did not have a C-section and she did not have an episiotomy, but if she did, I would assess the lacerations for redness, edema, ecchymosis, drainage, and approximation. I'm next going to move to the Homan sign. We're not actually going to be doing the Homan sign, but assessing for any blood clots. So I'm going to feel your legs now. I'm going to feel for any heat. And do you feel any tenderness?
No.
All right, both of those are normal. And I'm next going to assess her emotional status. I've noticed that she is bonding well with her newborn. She's been holding her when we're not doing an assessment and interacting a lot. And I'm going to also ask about her depression history. Have you ever experienced any depression or any postpartum depression?
No.
Sounds good. And now I'm going to be assessing if she needs a rogram. So in her chart, I saw that she her blood type is positive, so she will not need rogram. And that is it.
Thank you.
Thank you.